I feel like this patient was taken advantage of. If you ask my opinion, the doctors that treated this patient, they made a lot of money. Hello everyone, I'm Dr. Deuk. I'm a board-certified neurosurgeon with a focus in spine surgery, and we're here today with the Deuk Spine Institute's weekly spine case review. This is a patient who's on Facebook. I don't know this patient. This is not our patient, but as you know, on Facebook, a lot of people go for free advice, and this is one that caught my eye, so I decided to bring it up and talk about it. Now, Mary's had 17 months post-op since she had her surgery. Now, first thing I'd like to point out is that there's been more than one surgery here. This right here is a metal plate with screws, and these things here are screws that go into the bones. Between the screws and bones is the cage, and you see the back marker of the cage there, and you see the front marker there. So each of these cage has a couple of back markers and front markers, and the surgeon uses these markers to make sure they don't put the cage in too far. If you go past this back line here, you'll go into the spinal cord. You'll paralyze the patient. Now back here, you can also see that there's bones that are missing, and we call this a laminectomy. This would be a posterior cervical laminectomy. So you can see that there's bones right here, here, and then the bones are gone. So that means this patient's not only had surgery through the front of her neck and spine called an ACDF, at C4, 5, 5, 6, and 6, 7, but she's also had a laminectomy through the back. And they didn't do any fusion in the back of the spine, but they also put a spinal cord stimulator, which is like a last-ditch effort to get people out of pain. And this poor person's, Mary, is still in pain, as you can read from her post up there. So one thing I'd like to draw attention to is that, first of all, this whole area that's fused is not really fused properly. If you notice this area above the fusion, it's kind of curved, and it's curved nicely. Well, this part of the fusion is not curved, but it should be. So the surgeon did not curve the spine properly, and that's partly due to the plate's shape, but also it's due to how they decompress the disc spaces and whether or not they go deep enough and clean out the bone spurs in the back of the disc. If you don't get those bone spurs in the back of the disc, then you really can't jack these bones apart and get a nice curvature put back in the spine. The problem is if you fuse a patient straight, then that's going to be abnormal alignment for their spine. It's going to force the skull forward. And of course, nobody wants their skull face pushed forward, so they're going to pull their head back. And so the fusion is essentially, if it's done wrong, is going to force you to look down at the ground. And patients will then compensate by pulling their skull back above the fusion and below the fusion to look up. So bad fusions, which are very common, by the way, done all the time by surgeons I see. Bad technique forces the head to look down, the eyes are down, and then the patients don't want to walk around like this. They need to look at people's faces and look at the horizon. So they're going to pull up, but you can't pull the fusion up. The fusion is solid. There's no way you're going to move this. So the only place you can move is above the fusion and below the fusion. So what ends up happening is you wear the discs out below and above the fusion when the fusion is not done properly. So this poor patient has so much going on, but totally unnecessary fusion. If you watch this video right here, I'm going to show you the latest technology in repairing disc herniations in the neck. There's no need for artificial discs. There's no need for metal plates. There's no need for laminectomies or spinal cord stimulators. And there's certainly no need for what's called adjacent segment disease, where you start destroying the discs above and below. So watch this video. This is the Deuk laser disc repair.
Disc herniations are a common cause of chronic neck pain. The inflamed annular tear causes neck pain. Inflammation of the nerve roots causes arm pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. It can take up to 12 months.
Wrapping up, we can see that fusions are not necessary, that disc herniations can be fixed endoscopically, all natural, without actually putting in a bit of metal or cages. And that spinal cord stimulators really are very rarely used, especially in the cervical spine. I feel like this patient was taken advantage of. If you ask my opinion, the doctors that treated this patient, they made a lot of money just putting in all these things: laminectomy, spinal cord stimulator, artificial disc, and metal plate and screws. Now, these are not the typical artificial discs you hear about that are total disc replacements. These are actually cages, but they are sort of an artificial disc. And in the end, all these people did was increase this patient's pain and suffering, because you can see the adjacent disc down here at C7T1 is now worn out. And she's also going to have problems above the fusion because of the bad alignment and posture. Well, hope you enjoyed this segment and you learned something. I'm Dr. Deuk with the Deuk Spine Institute. We'll be producing these every week, so they're educational pieces. And hopefully you guys will learn a little bit about the spine and some of the problems that even we as surgeons can create. Thanks.